Thanks for that, Danny. Well, October is Breast Cancer Awareness Month, and today we have a very special guest with us, a nurse practitioner from Baptist Health, Ashton Ferrell. Thank you so much for joining us this morning.
All right, thanks for being here. Now, when it comes to breast cancer, we want to talk about, those signs and the symptoms to look out for, because if, you don't know someone who has breast cancer, or maybe you've never been through this before, you want to know what that looks like.
Yeah, so one of the obvious things that we think about, of course, is a breast mass, and that is absolutely a sign and symptom. It's a little harder to find yourself at home, but if you have a hard, immovable mass that you noticed in your breast, that is definitely a sign you need to talk to your doctor about. And then some of the other things that we need to think about is if you have new nipple inversion or discharge, changes in your skin on your breast, including redness, thickening, or dimpling of your skin are also important signs to look at. And then any sort of asymmetry or enlargement of any lymph nodes around your breast or in your armpit area.
Absolutely. And when we talk about ways for prevention for breast cancer, I guess the best way would be first getting that checked, right? And then what?
So, of course, like most things with health, maintaining a healthy weight with diet and exercise can help reduce your risk. Limiting alcohol use and smoking. And then if you have an infant, there's some studies proving that breastfeeding can also help reduce your risk. And then one of the main things is knowing your own personal and family history, so that you know if you are someone who needs to start screenings early and potentially look into more in-depth preventative treatments.
Absolutely.
And when it comes to survival rates of breast cancer, what does that look like, and are they going up with all this newer technology and preventions and things we have like that?
Yeah, so our survival rates are absolutely going up. The overall 5-year survival rate now is about 91.7%, so that's looking a lot better. And then, of course, the earlier that we catch it in the disease, our survival rates are that much better. With the disease that hasn't spread anywhere, that's only localized in the breast, survival rates are actually about 99%.
Wow, that's really good.
Awesome. Thank you so much. And we want to keep you here if you don't mind. We have a lot more questions to ask you about Breast Cancer Awareness Month. If you'll stick around, we'll have her here on 5 News This Morning. You don't want to miss that. And on 5 News This Morning Plus as well, we'll have an extended interview as well. Thank you so much for being here.